Mylohyoid muscle. The mylohyoid muscle lies beneath the anterior belly of digastric muscle and the stylohyoid muscle. It forms the whole of the floor of the mouth. It arises near the molars of the lower jaw and attaches all the way around the inner rim of the mandible. The mylohyoid is a muscle running from the mandible to the hyoid bone, forming the floor of the oral cavity. It is named for its two attachments, with the prefix mylo coming from the Greek word for molar. These muscles are mesodermal in origin, and the mylohyoid muscle is derived from the first pharyngeal arch. The mylohyoid muscle is flat and triangular. It is situated immediately above the anterior belly of the digastric and forms with its fellow of the opposite side a muscular floor for the cavity of the mouth. It arises from the whole length of the mylohyoid line of the mandible, extending from the symphysis in front to the last molar tooth behind. The posterior fibers pass medialward and slightly downward to be inserted into the body of the hyoid bone. The middle and anterior fibers are inserted into a median fibrous raphe extending from the symphysis menti to the hyoid bone, where they join at an angle with the fibers of the opposite muscle. This median raphe is sometimes wanting, and the fibers of the two muscles are then continuous. The mylohyoid muscle. The mylohyoids and anterior belly of digastricus are supplied by the mylohyoid branch of the inferior alveolar nerve, the stylohyoides and the posterior belly of digastricus by the facial nerve, and the geniohyoides by the hypoglossal nerve. Actions of the suprahyoid muscles. The suprahyoid muscles are the digastricus, the mylohyoides, stylohyoides, and geniohyoides. These muscles perform two important actions. During the act of deglutition, they raise the hyoid bone and with it the base of the tongue. When the hyoid bone is fixed by its depressors and those of the larynx, they depress the mandible. During the first act of deglutition, when the mass of food is being driven from the mouth into the pharynx, the hyoid bone, with it the tongue, is carried upward and forward by the anterior belly of digastrici, the mylohyoidae, and the geniohyoides. In the second act, when the mass is passing through the pharynx, the direct elevation of the hyoid bone takes place by the combined action of all these muscles, and after the food has passed, the hyoid bone is carried upward and backward by the posterior belly of digastricus and the stylohyoidae, which assist in preventing the return of food into the mouth. Innervation. Along with the anterior belly of the digastric, the mylohyoid is innervated by the mylohyoid nerve, a branch of the inferior alveolar nerve, which is a branch of the mandibular division of the trigeminal nerve, the fifth cranial nerve. Action. The mylohyoid depresses the mandible and elevates the hyoid, the floor of the oral cavity, and the tongue. These actions are particularly important during swallowing and speaking.